Hi class, my name is Julie Hughes. I chose the coronavirus simply because it's pretty obvious that that's what we're being faced with today, and I'm sure probably more than the class has chose this as well. But working on the front lines of this disease at UAB, I just personally wanted to learn more about the virus myself, so that's why I chose my topic. I included a quote I thought was appropriate for this time. It is by Mahatma Gandhi. It is health that is the real wealth and not pieces of gold, because I feel like um, with the current pandemic that we are kind of faced with what's important, which is our health. The objectives of this PowerPoint is to define the coronavirus. I also included in mine pandemic versus epidemic. Statistical information, which has changed every day. So as the information has changed, I have updated my PowerPoint for 2 weeks. Comparison to other pandemics, demographics, the impact of the coronavirus, the prevention measures, activities to enhance all levels of prevention, and screening tests and the cost for patients. And lastly, benefits versus harm related to the screening process. This is a photo I found of the coronavirus. As you can see, it has the spikes, and it's called the coronavirus because corona means crown. And if you look at it, if it was cut in half, it would look like a crown. What is the coronavirus? Coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome such as SARS, and Middle East respiratory syndrome, MERS. And in 2019, a new coronavirus was identified as the cause of the disease outbreak, which began in China and is now the pandemic known as COVID-19. And why is the coronavirus a pandemic? It's a pandemic because it affects a wider area. In this case, it is worldwide. It affects a larger number of people. And most often it's caused by a new virus or a new strain of viruses. And humans have little or no immunity against the virus. And causes increased deaths and often creates social disruption and economic loss. And in this case, with the current COVID-19, all of those apply. An epidemic is the rise in the number of cases of a disease more than what's expected within a particular area. But in this case, it's a pandemic since it is worldwide. How is the coronavirus affecting us? World statistics, I updated this today. However, tomorrow I'm sure it'll be a new number. But so far, worldwide, it's over 1 million cases with 54,000 deaths. In the United States, 245,000 cases with 6,000 total deaths. And I compared the coronavirus pandemic to other pandemics, the last one being the swine flu, which was a little more than 10 years ago. It affected 1.4 billion people and killed almost 152,000 people. That was the second largest pandemic, only second to the Spanish flu. I'm sorry, I had a brain freeze. The countries most affected by the coronavirus, United States. I also had to change this from 2 weeks ago, where China and Italy were on top of the list. Now the United States leads the world in corona cases. Global implications. I don't think this is a true picture. I probably should have updated a current one where it's almost completely blue, the entire globe. Some ways a pandemic can change the world. The personal becomes dangerous. And what I mean by that is the comfort of being with others is replaced by a greater comfort of absence. And a new kind of patriotism. People are beginning to recognize that true patriotism is saluting those such as in healthcare and those responsible for every day and who are sacrificing for their lives. A decline in polarization, and that means people will begin to look past their differences when faced with a shared external threat. A return to faith. People are forced back to accepting that expertise matters as Americans, and they return to what really matters. Less individualism. People could turn towards authoritarianism, such as people feel less in control. A new reform, meaning that people are relying more on the government. The first defense in fighting any virus, not just the coronavirus, of course, is hand washing. And that should be done for 20 seconds. If you do not have soap and water available, hand sanitizer is acceptable, but preferably hand washing. Disinfect, that can be done with Clorox, Lysol, any of those products. Cover coughs and sneezes. Stay at home. Wear a face mask and avoid large crowds. And like I said before, wash hands often with soap and water for at least 20 seconds, especially after touching others, blowing nose, coughing, or sneezing. Avoid touching your face. That's the biggie. Use hand sanitizer, as I said earlier. Avoid close contact. Wear a mask. Cover your mouth. And the latest is self-isolate. How coronavirus has impacted the world? Well, as we all know, the economy has slowed significantly. The global growth and the world is in a financial crisis. Travel and tourism is the hardest hit right now as airlines are facing economic turmoil. And politics, governments have uncoordinated country-specific responses to the virus. So we'll see how that unfolds at election time. Next is screening test. First of all, screen the patient. Do they have symptoms? Some of the first symptoms of the coronavirus is a dry cough, malaise, inability to smell or taste, and some shortness of breath. So at this point, the patient should be screened, in particular if they're running a fever. And how the test is performed, it is a nasal swab, and it's very, very important. We've been having some false negatives at work. We have retested bronchial secretions, and those tests have come back positive. So it's very, very important to swab the patient all the way down the nasal passage. How much does it cost for COVID-19 screenings? Well, some places say perhaps free. From what I've found, it's anywhere from $35.91 to $51.31 per test, depending on the patient's insurance. The most important benefit to early testing is the obvious. Once the patient's diagnosis, allows the patient the opportunity to quarantine from others, which in turn decreases the spread of the disease. The risk is a false negative result. This could be detrimental to the patient as well as those who the patient comes into contact with. And like I was saying earlier, it's very, very, very important to adequately swab the patient. So you will not get that false negative, and the patient can quarantine and stay away from family and stay away from the public, which will in turn decrease the spread of the disease. Thank you. Have a great evening.